Now we've been doing knee flexion. So the 3 points we got for the proximal, we got aligned with greater trochanter. For the pivot, it's the lateral epicondyle, and for the distal, it's lateral malleolus. We're going to ask the client to move their feet towards their body, keeping the knee on the surface. And that's it. And we have a reading of 125 degrees. Now we've been doing knee flexion. So the 3 points we got for the proximal, we got aligned with greater trochanter. For the pivot, it's the lateral epicondyle, and for the distal, it's lateral malleolus. We're going to ask the client to move their feet towards their body, keeping the knee on the surface. And that's it. And we have a reading of 125 degrees. And now we'll be doing external rotation of the hip, and the leg would be moving inwards towards the other leg, and we got the same markings. We got the mid patella and anterior part of the tibia. So can you move your leg towards the other leg without moving the knee? Yep, keep going. As far as you can, until you feel pain. And that's it. And we got an angle of 15 degrees. Now we'll be doing medial rotation for the hip, and the 2 points we have is mid patella and anterior of the tibia. And we're going to ask the client to move their leg outwards and try to go as far as they can without removing their knee. So start going. And that's it. And we have an angle of 25 degrees. Go. So now we'll be doing lateral adduction of the hip, and we got the same 3 points. We got the mid patella for the distal part. For the pivot, we got ISIS, and we got to align the non-distal part with the ISIS. So we're going to ask the patient to lift their leg up, keep their palm on the ground, and we're going to ask them to move inwards to the other leg. So ready? Up. And that's it. Relax. And that's 13 degrees. Go. So now we'll be measuring the hip extension. We asked the client to lay down on their stomach, and we got the same 3 points that we did before in the flexion. We're going to align with the mid-axillar line, lateral greater trochanter, and lateral epicondyle. And we're going to ask them to lift their leg by keeping this hip on the platform. And I'm going to ask them to lift their leg and keep it straight. I'm going to ask them to lift as far as they can. And that's it. And that's 6 degrees.
What?